Okay, so hello everyone. Welcome everyone joining us on Facebook. We're on Facebook Live and also on Zoom. So let's wait for a couple of more minutes. So in the meantime, you can post in the comments where you're coming from, where are you joining us, and let's for a few more people to join us, and we can get started today's podcast. Okay, so we hope that everyone can see us and hear us. If you can just let us know in the comments if everything is fine and we can get started. So once again, hello everyone, welcome to Let's Talk FM podcast. We're discussing here all sorts of subjects related to FM business. When you tune in, you can listen to successful stories from our business partners, but that's not all. We also talk here about business, marketing, leadership, our products, and healthy lifestyle. So my name is Marcin, and today with me is a very special guest, Dr. Tomasz Jezewski. So let me tell you a few words about himself. So he's a medical doctor with 20 years of experience. He specializes in internal medicine and cardiology. He effectively engages with patients, and he's focusing on healthy lifestyle and lifestyle modifications. So his main aim is to persuade his individual patients that when they change daily habits, they can prevent numerous diseases and also they can maintain health. So today with Tomasz, we are going to discuss the questions that you had a chance to submit through Messenger. Some of the questions I received also to my email. So if we don't have enough time to discuss all of the questions, don't worry. Today is just the first meeting and there will be many more to come. So thank you very much, Tomasz, for joining us today.
Yeah, thank you for inviting. Thank you for having me.
Yeah, so if I forgot about something important when I was introducing yourself, you can just complete your introduction. So can you tell us a few more words about yourself?
Yes, it is true. I am a medical doctor. I am a trained specialized cardiologist, invasive cardiologist. I'm also a specialist in internal medicine with quite an experience in both specializations. But since 10, 12 years, I started to dig more and more in lifestyle medicine and contemporary measures of optimizing our lifestyle, our longevity, and our health span. So that's why I'm here, because it is much more beneficial for us to prevent than to treat the conditions that we already get. So it's better to treat symptomatic problems. It's much better to prevent them.
Mm-hmm. So, before we start with the specific questions, can you just briefly tell us what is a food supplement and does everyone needs to take them nowadays? Because very often we hear different things from different people that nowadays it's very important to take food supplements. So what is it and is it really true?
Yes. The supplements are important issue nowadays, but we have to state the obvious statement that the diet and the proper lifestyle is crucial. It's just a fundamental for us. And we cannot say that everyone needs some certain supplements because it's not logical generally. If you have a proper diet, if you exercise, if you sleep, if you regenerate, and of course, if you live in some certain parts of the world, because the sunlight is also important. A lot of details are very important for us. So let's say in the ideal world, if you behave if you are located in the perfect place and time, you can imagine the situation that you don't need any supplement. But the devil lies in the details. That's why, for sure, not everyone meets those perfect conditions. And that's why we see the need for supplementation, but the list of the supplements for the particular person will be different among us, of course. So, of course, my list of supplements I need will be different than other people, probably, depending on my sex, my age, my nutrition, my medical history, for instance, the place I live every day. So this is a very important issue, that supplementation cannot replace good lifestyle, but the place for supplementation is to fill the nutritional gaps, to make your lifestyle perfect, and yes, to avoid any problems in your future.
Yeah, so obviously that depends on many different factors, as you said, but in FM, we've got many different supplements that you can take in order to address different health problems and maybe to maintain health. And very often people ask, how many supplements can you take at once? And how do you determine that? Because obviously some people want to improve their immune system, but at the same time, they want to take some supplements in order to build muscles. But at the same time, they want to take some supplements in order to improve maybe skin condition. Maybe at the same time, they want to take some supplements to build stamina and energy. So is there any rule that you would advise to follow in order to determine how many supplements someone should take at once?
Yes, this is of course to answer such a question is quite difficult, because we have different needs, and you pointed those goals, our personal goals, they can differ. So I will give you maybe the shortest possible my list of supplements. So I call them, let's say, essentials. Yeah, for me, of course, we can build on those essentials, but what is most important for me? Well, for me personally, is most important is vitamin B12, because I'm on a plant-based diet. The second is vitamin D3, because I don't live in the perfect place concerning the amount of sunlight and exposure. So I need to supplement my D3. Probably I would also like to have some organic vitamin C in my supplementation list. So if we consider gold, silver, and bronze medal, I listed just 3 supplements. Does it mean that is it all? No, because now we talk about those goals you listed. Yeah, to building stamina, to focus, to regenerate, to build muscles and others, immunity. And I was listing my 3 supplements just to show you my personal example. I think every one of us should make a list of the priorities of the most important goals, personal goals. And I think that sometimes we are not aware of all our needs. And sometimes we should check this list with our health coach, with our doctor, to consult it, because your expert can show you some weak points to consider. And then we should prioritize our goals, because now we go to the number of the supplements. Of course, I told you about the three most important for me because they are very high in my priorities. It doesn't mean that I do not take any others, but these are very high. So you should make a list of the problems of your goals. You should prioritize those goals. You should, of course, it would be nice to measure the effectiveness, yeah, of your intervention, let's say, with supplementation and lifestyle. And then we go to the number. Well, if you make a structure of this, then we go to the number, what we need, and we look for the specific supplementation systems that will easily fulfill those needs. Yeah, that's
Yeah.
my, let's say, rationale.
Yeah, but I think also, you know, thanks to that, I think that's also a great idea for our business partners when they speak to their potential customers. I think they should also take a seat with them, not only show them what sort of supplements we've got, but also determine what their needs are and what sort of problems they would like to resolve or address in their life.
Yeah, this is crucial. That's why we begin with this. Yeah, to make a list of the priorities. Sometimes, and I pointed out, sometimes your client, probably you, are not aware sometimes of some very important issue for your health. And some of the goals, which is also important, can be contrary to each other. Yeah, because I will give you a simple example. If you want to build muscles, and if you want to live long, you can have quite opposite actions, because now you want to you know, induce your anabolism to build your muscle mass, and for the longevity you want to slower down some processes in your body in order to live longer. And sometimes people are not aware that some actions are opposite. And that's why sometimes you need a coach or a good advice. And maybe that's why we are here and we are talking about it. Yeah.
Okay, great. You know, just one more short question before a specific question. Because a lot of people asked, can teenagers take our Nutricode supplements? Because obviously our supplements are created for adults. But is it possible for someone who is 15 or 16 years old to take some of our supplements?
Yes, of course. Teenagers are. It's a very tricky period. If we talk about 11 years of age, 12, 13, they just they are early teenagers, let's say. And then you have rapid growth phase. You get taller very quickly, and your demand for nutrition, for nutrients, for vitamins and minerals is huge in this rapid growth period. So we have to split teenagers into, let's say, even 3 parts. Early teenager, so the than adult is lower much than adult body mass, and in this period you should recalculate the dose of the supplement, so they are not contraindicated because they are just okay, but the dose is calculated for the adult. So we should, let's say, divide the dose according to the body mass in 11, 12 years old. Then you get the rapid growth phase, and generally speaking, you are closer to the adult demand for the nutrition and all those supplement substances. And then after the rapid growth, you have still teenager,
Yeah.
but it is almost an adult because the body weight is adult. And in this group, so late teenagers after 15 years of age, it's practically dosing of the adult, and the indications for the supplementation is completely equal to adults.
Okay, perfect. So now let's move on to a little bit more specific questions. And I'm sure that all of you who are joining us know Inner Balance. So Inner Balance is the first mandatory supplement that people need to take when they join our Fit6 weight loss program. It comprises day, instant sachets, and night capsules. And the night capsules contain lemon balm extract and also hops, which are supposed to have calming properties and help to fall asleep. So one of the questions I received from Rita was why Inner Balance night capsules may not work for some people in terms of facilitating sleep.
Yes, this is generally about the inner balance, but the answer will be much broader than the inner balance itself. Because we can ask the question why some supplementation system is not effective in particular person case. The first reason is, and the most important reason, is that in a lot of patients we have underlying medical condition. Sometimes it is recognized and we have diagnosis, but very often it's unrecognized. And we want to fix the problem, like maybe sleep regeneration and effectiveness of sleep in inner balance. But we have a patient who need to be diagnosed properly, because introducing the supplementation system itself won't solve this problem. So we can talk about the sleep apnea, chronic pain, about the unrecognized depression, about unrecognized anxiety problems. So a lot only with the sleep, but of course the answer is much broader. So if we have such condition, the patient should be properly diagnosed, should have a plan of the treating this problem, and the supplementation system goes on top of it. That's why, of course, the effectiveness is not as we expected. Is that the supplementation system goes on top of the good lifestyle. So if we concern the sleep, we should have a good sleep hygiene, which is crucial. You should have dark room. You should avoid the screens in the evening hour. You should have a, let's say, cooler temperature in your room, and so it is whole bunch of the issues you should address, and then on top of it give some really nice organic substances that that will further help you, but you cannot do it instead, and last issue, the third, we cannot forget that some people have different genetics, and some people will respond a little bit differently. Sometimes you see a nice action in one patient and almost none in the second. So this is the third issue answering this question.
Yeah, but we can also say, referring to our previous question, that sometimes it may depend on the body mass, right? So there are certain individuals who may be a little bit bigger. So their body mass is bigger than, let's say, an ordinary person, and obviously some herbal substances may not affect them as effectively.
Of course, we should always be aware that roughly the dosage is calculated onto the average person, and we calculate this average like more or less 70 kilograms. So of course, this is also very important.
Yes, because we started our conversation from the topic of weight loss, there is a question from Charlotte. Do you need to continue taking supplements once reaching your weight goal? And if yes, for how long? Because obviously, yes, we have our Fit6 program with clearly stated rules, but if someone would like to take some supplements on their own outside of the Fit6 program.
I have problems. Do you hear me?
Yes, I can hear you.
I have problems with do you hear me? Because I cannot hear you. Okay.
Okay. Does it work now?
Sorry for this.
Yeah, let's check on Facebook.
Oh,
so,
yeah.
Can you hear me now?
Now it's okay because I got the connection on the watch. So
I see.
About this weight goal.
Yeah. So
this is very important, and you are, let's say, satisfied with your reaching your weight reduction goal, and we have to say that the supplement is to support the proper diet. So together with the supplementation system, you should introduce and try to learn new, let's say, dietary nutrition habits that should stay with you in your future. If you reach your weight reduction goal, of course, you can stop taking this kind of supplement because you reach the goal, but you should maintain the healthy diet. And at this particular stage, you should re-update, let's say, your list of goals, because you are after the phase 1, you reach your goal, you are satisfied, you are happy. You modified your diet, you should maintain the diet, but you should make a list of your goals, what you need on top of the diet in means of nutrition, delivering all the nutrients. You just need a different kind of product, let's say, for the maintenance phase, not for the reduction phase. I think I would approach this way this problem.
Yeah, so basically, if those ones of you who watch us live now, you know the Fit6 program, you've got clear rules there. So there are 3 stages, and the 4th stage is the maintenance stage. So basically, yes, diet comes first, and then supplements, as the name suggests, they just supplement the diet. And they help with providing nutrients, but also may help with speeding metabolism, etc.
That's it.
So how about, after having a baby, let's stick a little bit to the weight loss. A lot of women struggle to lose weight. Obviously, a healthy diet combined with regular exercise is best way to shed the pounds, but caring after a newborn and managing all the responsibilities outside parenthood makes losing weight a little bit difficult. So the question is from Alice, are there any Nutricode supplements that you would recommend to take for post-baby weight loss, which will also be safe during breastfeeding?
Yeah, of course, this on every leaflet in the medication and supplementation system, you always come across the pregnancy and breastfeeding, because these are the special periods and the special states. Of course, the demand for nutrition is very high. It should be very diverse. So the diet is crucial. If the diet is unprocessed, if you have a lot of plant-based compounds in your diet, if you have a lot of fiber, you will reduce your weight gradually during breastfeeding, because it's not natural process, yeah, because your baby will take away a lot of your calories as well. But we go to the supplementation. In this period, I wouldn't recommend the supplementation system that act as speeding the body weight reduction supplementation system. So I wouldn't force this reduction during this period. You can of course switch to dedicated reduction supplementation system just after the breastfeeding, if you stop, discontinue breastfeeding. But of course we have let's say example of the supplementation system to ensure your nutrition, to diversify your nutrition, and to tune your metabolism. And the most comprehensive I think that comes to mind is a body and mindset for her. If you look at this particular supplementation system, it's completely okay during breastfeeding. It's full of vitamins, minerals, organic substances, phytonutrients, antioxidants, everything. But it doesn't itself speed up the process of the body weight reduction. So this is okay for you during breastfeeding. If you discontinue breastfeeding and you still want to reduce some weight and speed this process up, then you can switch to the dedicated system.
Okay. And another aspect which is quite important, and I'm sure that a lot of our business partners, they struggle with recommending some supplements, is that nowadays people take different types of medications. So both those ones for prescription, for example, diabetes, hypertension, statins for, cholesterol, SSRI, the antidepressants for anxiety, and so on. Or on the other hand, just those medications available over the counter, like common painkillers, ibuprofen or paracetamol. So the question is, can you take Nutricode supplements while taking medications? So let's divide the medications maybe in two groups. So first ones, those for prescription, like diabetes, hypertension, cholesterol, depression. And the second group, the original painkillers like, ibuprofen or paracetamol.
I don't know whether we should divide them, because the case that it's more available for you makes it even more dangerous sometimes.
Okay.
But okay, let's go to the supplementation. Of course, we have a risk of interactions with some substances, active ingredients in our supplement systems. Of course, some of them are more common, and some are completely very rare. But the first case, it is a kind of disclaimer. If the person has any medical conditions and is treated, I would advise always to talk and consult the supplementation also with the doctor, because we look for benefit, but the first thing is not to do any harm. Primum non nocere, as from Latin. So I will, of course, I have a list of the most popular, let's say, interactions with the vitamin K, for instance, and blood thinners. Blood thinners and the drugs dealing with coagulation and coagulation problems generally in our patients or clients this is the field prone for interaction. So vitamin K, of course, omega-3s, ginkgo biloba as well, ginseng as well with the blood thinners, and of course simple garlic. If you eat garlic, it also it also rises a little bit bleeding risk. So as you can see, we have even with vitamin C or garlic some risk of interactions, and this is important. You should be aware that these are the most popular. We have issues with between calcium and iron absorption. It is very, it is very important one, but it's not so well known and popular. A very important one is, and you should be aware that a lot of people take metformin because of diabetes and pre-diabetic states, insulin resistance, and they take the metformin quite a long time. And there is a risk of vitamin B12 deficiency because metformin blocks absorption of vitamin B12. So as you can see, we have quite a lot of popular interactions. They are not life-threatening, but we should be aware. And if you take the history of the patient, you list the drugs, you can adjust the supplementation for sure better for the patient to be safe. I'm sure.
Yeah, and now, guys, there's a very good news for you, because when you go to our online shop, we've just recently updated the description of the products, all of the supplements, plus there is a comprehensive list of all of the components a certain supplement contains and how to take it. So, for example, if you speak to someone, your potential customer or someone from your, family or friends, and they are on medications, you can always go to the online shop, check the list of the components a certain supplement contains, and then consult the doctor. So you don't need to buy the supplement beforehand. First of all, you can just check the components of the supplement and then consult with the healthcare professional in order to find out whether it's safe to take this particular supplement or not. And how about antibiotics? Because some people may be taking some supplements and all of a sudden they've got a bacterial infection and they need to take antibiotics. So should they stop taking their supplements when they take antibiotics, or they can continue?
Generally speaking, they should continue, but there is a simple, let's say, issue with and be aware of magnesium and calcium. These are popular supplements, but I wouldn't advise to take magnesium and calcium supplements together with the antibiotic. So generally speaking, you should leave your supplementation, but look for calcium and magnesium, and try not to take those capsules with those two minerals together with the antibiotics. There's a simple rule for me.
Okay, so now I've just got a question from Sami, and so she said she's just had a surgery, and she was wondering if she can take Drina Plus that will help with lymphatic drainage after surgery.
Yes. If the hemostasis is okay, because this is very important phase. So no bleeding, no active bleeding. The clotting is okay. Yes, it is possible. Yes.
Okay, perfect. So let's move on. This topic is partly related to medications. But before I'll ask the question, something quite worrying. I've recently read that a report that was published on Friday that the cancer research in the UK projects that if current trends continue, more than 500,000 people in the UK will be diagnosed with cancer every year by 2040. So it's definitely quite worrying. And it is a result of mainly unhealthy changes that affected the diet, lifestyle, obesity, the environment, but also our microbiome. But the question is, can patients who undergo chemotherapy take food supplements during and or after chemotherapy?
Yes, generally, this is very important question, but you know, chemotherapy is a very aggressive treatment.
Yeah,
it is treatment that is aimed to kill the living cells inside your body. Of course, the aim is to kill the tumor, but as a collateral damage, it kills also your cells. So your demand in this particular, during this particular treatment, your demand for supplementation, for the good nutrition to regenerate your body, to win over the cancer is huge. But of course, the question is very, very important. So there is a need to, you know, to supplement, but this is the, let's say, sometimes critically, but very severely ill patient. So without consultation with the doctor, you shouldn't make any decision during this period. But there is a benefit, and this benefit is huge with the good diet and supplementation. This is the support that your body critically needs during the chemotherapy. So we should of course use this supplementation, but of course we have so many different kinds of chemotherapeutic options and ways of acting of those drugs. We have immunotherapy, we have classical chemotherapy, we have angiogenesis therapy. So without consultation with your oncologist, you cannot make your own decision.
Mm-hmm. So again, it's very important to consult the healthcare professional before taking any supplements. However, it may be quite beneficial.
Yes, of course.
So the next problem is not maybe that serious, but also a lot of people nowadays suffer from it, and that's reflux. It's also known as heartburn. So this is a condition that basically is caused by unhealthy diet, but also stress. There may be other factors as well. And sometimes people may have heartburn when the stomach produces too much hydrochloric acid, and sometimes when it doesn't produce enough of hydrochloric acid, and then the sphincter, which is supposed to be closed, opens up and all the acid goes up through the esophagus, and then it gives you that sort of unpleasant sensation. So are there any supplements that people suffering from acid reflux can take? Or
yes,
maybe
they can.
those ones they should avoid.
Yes, I would rather start with those they should avoid, because it's not so long list. The majority of supplements are generally okay, but maybe you know more aware or maybe not. But vitamin C generally it is acidic itself. So you should avoid taking vitamin C supplement on an empty stomach. Mm-hmm. So this is the first. The second, if you supplement iron, the same case, not on empty stomach. If you are prone for the reflux, because iron irritates a little bit stomach and can exaggerate those problems. The third is the way you supplement calcium, because if you supplement calcium citrate, it's perfectly for those people, for this group of patients with acid reflux. But if you take calcium carbonate, it's not so good. So if you have acid reflux, you should choose citrate carbonate. It will be you will feel more relieved after such a calcium supplement. What it comes to fish oil. if you have an idea to supplement, let's say, omega-3s with the fish oil, so in acid reflux patients, they won't tolerate it so nice. So you shouldn't give them alone always with the food if you have to. Yeah. So maybe, and of course, the last scenario is, let's say, multivitamin. So if you have a lot of, let's say, chemical compounds, let's say old-fashioned multivitamin, and it contains vitamin C, some calcium, some iron. So those I listed in a minute ago can be in one multivitamin. So you should be aware not to take on an empty stomach.
Yeah. So how about, because you mentioned vitamin C. So vitamin C may come in different forms, and we've got two different types of vitamin C. We've got the one which is the ascorbic acid. And also we've got liposomal vitamin C, right? Which is locked in the lipid capsule. So how about the liposomal vitamin C for people who suffer from reflux? Would that be a good solution?
It is much better solution, because the one case is the form, which is more advanced. You have this cover, so the irritation will be much less. And the second is with the vitamin C, very important is the dose. So the problem with the acid reflux, predominantly we see in the patients who want to take very high doses of vitamin C, which is quite unnecessary in majority of cases. So the dose and the way of the capsule is, this liposomal form is very important. Those two issues are important.
Yes, as you mentioned, people very often think that more is better, but like with vitamin C, our body will absorb as much as needed, and then the rest will be expelled into the toilet. So basically, I sometimes say that if someone takes few thousands of vitamin C in one dose, then they will produce a very expensive urine.
Yeah, it's very expensive urine, and of course there is also a problem with some stones in urinary tract, because this huge amount of ascorbic acid makes the risk a little bit higher. So this is the additional work for your kidneys, and there is a risk of urinary tract problems. So there's no need. We look for benefit and not to cause any risk with such a supplementation.
Yeah. A lot of our supplements come in a form of a capsule. So they come in capsules. And unfortunately, there are some people who hate swallowing capsules. So is it possible to open the capsule and dissolve the contents in a glass of water, or maybe less, and just drink it this way?
Yeah, of course, the capsules are just made because we have to deliver in some way, and we have to be sure that the dose is, strictly, as the receipt of the system of supplementation tells you. So the capsule is like vehicle for those substances. Of course, you can dissolve this in a glass of water. For some supplementation substances, it's better to dissolve it in maybe a yogurt or maybe a bit of oil if it's more lipophilic substance. But of course, it is possible. The case is only the taste, yes, because sometimes the taste is an issue for some substances, but from the safety point of view, it's okay.
And one more question from Sami. So here we're talking about going back slightly to the medications. She just wanted to confirm that grapefruit extract, for instance, can interfere with medications like antidepressants or blood pressure medications. So, for example, the fat killer that we've got in FM wouldn't be okay in this case. So what do you think about that?
Yeah, with grapefruit, we have some issues because it occupies, let's say, one enzyme chain in your liver that serves as a metabolic pathway for some drugs. That's why, of course, if you want to be the metabolism of the drug or some supplements or substances to be predictable, you should rather avoid eating grapefruit just close to the dose of the drug. And of course, it's an issue with quite a long list of drugs, the blood thinners, but also we have like cholesterol lowering agents with the drugs in a high blood pressure treatment, hypertension. Of course, I would avoid this grapefruit juice if I want to have to be sure that the metabolism of the drugs and other substances is predictably as I want it.
Okay, perfect. So I think that's enough for today. So thank you very much, Tomasz, for joining us today. So it was our first podcast, but I'm sure not the last one. We're going to have many more to come. So if you have any more questions, you can always send me the question, text, use our WhatsApp, or you can even post the questions under this live on Facebook. I'm going to take a look later on at them, read them, and we can organize another podcast very, very soon. I just also wanted to let you know that if you are unsure which supplements you can combine together, you can go to our website and you can find a new tool over there. You can just simply and easily check which Nutricode supplements can be combined together. So after the webinar, after the podcast, please go to the website and check that out. So thank you very much once again, Tomasz, to join us. Thank you very much for all of the knowledge and answering all of the questions.
Thank you. It was a pleasure for me.
Yeah. So we'll speak soon.
Okay.
Take care, everyone.
I'm looking forward to meet you again. Thank you.
Definitely we will. Have a nice evening. Take care.
Take care.